Hello, this is Dr. Nony, board certified internal medicine physician. A 19-year-old gasping for air. No fever, no infection, just a vape in his pocket. A mom in her 40s switching from cigarettes to vapes because she thought it was safer. Now she's in ICU with something called E-Valley. Vaping was supposed to be an healthy alternative, but what if it is just the same devil in a new disguise? Let's talk about it. No hype, just science and what I see in the hospital every week. About 6 months ago, I admitted a young man, 19 years old, college sophomore, no history of asthma, no infection on his chest x-ray, but he couldn't breathe. He was pale, sweaty, oxygen dropping. We rushed him to the ICU, his lungs completely shut, inflamed. His CT scan looked like someone twice his age with end-stage COPD. The diagnosis: E-Valley, e-cigarette or vaping product use associated lung injury. He had been vaping for 2 years, thought it was harmless. Flavors like mango, mint, blue ice, nothing dangerous, right? But his lungs, they told a different story. Let's break down what happens when you vape. You're inhaling an aerosol, not just water vapor. Inside that cloud are nicotine salts designed to deliver high doses very fast. Proline glycol and vegetable glycerin. These are solvents that when heated break down into formaldehyde and acrolein, which is toxic to the lung tissue. Flavoring agents like diacetyl, which linked to bronchiolitis obliterans or popcorn lung. Heavy metals like nickel, lead, tin from the vape coil. Lastly, volatile organic compounds, which are potential carcinogens. A lot of bad stuffs, right? Now, what is E-Valley? E-cigarette or vaping product use associated lung injury. In 2019, a surge of severe unexplained lung injuries landed thousands in the hospital. Many needed ventilators, some didn't even make it. Most were using THC vapes, often black market, but even some nicotine-only users developed it. The culprit, vitamin E acetate, added to thicken vape oil. Sounds harmless, but inside the lungs it disturbs the surfactant, which is the substance that keep your air sacs open. The results: inflammation, collapse, and severe hypoxia. Symptoms including cough, chest pain, shortness of breath, GI symptoms, and ground glass opacities on CT scan. And it can happen fast, meaning people who are fine a week ago now came in with complete picture or E-Valley. Now let's talk about nicotine and what it does to your brain. Nicotine hooks into acetylcholine receptors in your brain's reward center. That triggers dopamine, the feel-good chemical. But over time, your brain adapts. It reduces your dopamine production. It becomes dependent on nicotine to feel okay. You build tolerance and you get withdrawal symptoms like irritability, anxiety, mood swings, or even depression. And if you are a teen or young adult, the impact is even worse. The prefrontal cortex, the part of the brain that handles decision making, impulse control, and emotion regulation, is still under construction. Early exposure to nicotine literally rewires the brain. That's why vaping in adolescence is linked to mood disorders, poor concentration, high risk of addiction to other drugs. Vaping doesn't just hook you on vapes, it doubles your risk on moving on to regular cigarettes. Even so-called nicotine-free vapes, some have been found to contain nicotine anyway or other harmful chemicals not listed on the label. This is not a regulated product. It's a wild west and your lungs are the guinea pigs. Let's go back to the mom in her 40s. She was trying to quit smoking, using vape as a safer alternative. She told me, I thought I was being healthy. But over the next year, she developed chronic cough, shortness of breath, while walking upstairs, and finally a trip to the ER where her oxygen was in the 80s. If you look at her CT scan, you see diffuse lung damage. Her final diagnosis is chronic vaping associated lung injury, not acute like E-Valley, but progressive and possibly irreversible. She is now on steroids, inhalers, and oxygen therapy. She can't believe how little anyone told her about the risks. So here what I tell my patients and what I would tell you. Don't assume vape means safe. It's inhaled chemicals, many of which have never been studied long term. If you are trying to quit smoking, talk to your doctors. There are safer, proven ways. Patches, gums, medications, behavior therapy. If you're already vaping, track how often. Ask yourself, is this a stress habit, social habit? Do I actually feel better or just dependent? And if you're a parent, talk to your kids early. These devices look like USPs. They smell like candy, but they are not harmless. I'm not here to scare you. I'm here to show you what I see in the ICU, in the clinic, and in scans that don't lie. Vaping is marketed as sleek, harmless, or even healthy. But the reality is addiction wrapped in fruit flavor, and sometimes it's a ticket to the ICU. If this video made you think, share it with someone. Drop a comment, tell me your story, and hit subscribe. This is Dr. Nony from Dr. Nony's Power Lab, where science meets real life. Take care of your lungs and question anything someone tells you is harmless. Thank you for listening and have a great day. Bye bye.